What you are about to hear is not a podcast. This is a global conversation recorded live in real time with real people.
Journalists,
business leaders,
academics, politicians. I think the terms are deep state. Oh dear.
investors,
Experts, diplomats.
citizens.
Coming together from around the world to share their views and ask our guests the questions. If you would like to join this conversation or hear our incredible library of past conversations, please visit our website, pm101.club, and join the fastest growing conscious community on the free internet. Thanks for being here.
Enjoy the
Enjoy the show. Hey everyone, welcome back to Politics Media 101, the place where we hear live and direct from people in the news, in their own voices, in their own words, in long form, and where anyone who wants to can join to ask them a question, share their thoughts, or just listen. Today we're excited to release part of a conversation, interview, and audience Q&A we had with Sheryl Gay Stolberg of the New York Times. She spent more than 2 decades covering the White House and Congress up close and is a top expert on health policy in the United States. In our last episode, we did a deep dive on global COVID response, how governments around the world are addressing the virus. In this episode, we're bringing it back home to do a deeper dive on response in the United States, including how the Biden administration is doing, how the Omicron variant is changing the picture, challenges with vaccine rollout, and why death rates in some parts of the country are way higher than in other parts of the country. There's a lot of bad information floating around out there on the internet about COVID. Sheryl's one of the top experts anywhere in the world, so we were excited to hear from her directly and for our audience to ask her questions. On the day we spoke with Sheryl, she had just finished taping an episode of the New York Times Daily. It was a great conversation, and we hope you enjoyed it as much as we did. As always, if you like or dislike what you hear, if you want to find out how to join us live almost every day of the week, maybe ask one of our upcoming guests a question, or hear past episodes, please visit our website, pm101.club or pm101.live. They both work and will get you to the same place where you can find all that and more. Without further ado, let's roll the tape.
So I want to start out by setting the table, Sheryl. Today in Cleveland area hospitals ran an ad with one word. It was help. Minnesota doctors ran an ad a week ago urging people to get vaccinated. So you have 2 different states, 2 different hospitals, basically saying they're overwhelmed. With Omicron in the early stages, we don't have a full picture of mortality yet. We need more data. We need more time. But how hard are hospitals currently being pushed? And how concerned is the Biden administration about potential overload of our hospital system?
Well, very concerned, and as well they should be. American hospitals are already straining with the Delta surge. And the thing about Omicron that people, I think, don't grasp is that while it does appear to cause very mild disease in vaccinated people, it is so infectious. It is causing so many people to be infected that by sheer numbers, even if only a small percentage of those infected are hospitalized, it's still going to be a very big number. And hospitals are very worried that they are going to be overwhelmed. There's even talk of having hospital workers who are themselves infected go back to work if they're feeling up to it, because they're going to need the staff.
That is rather scary. And it's at a point where I got vaccinated in the beginning of April, so I need to get my booster. I'm announcing that to the world.
Yes, you do.
I'm not anti-vax. I just need to actually go out and get it. But my question is, basically, you have a bunch of people like myself who the vaccine of efficacy is starting to wane, basically. Eric Topol, public health expert of Scripps, suggested that 3 shots be considered as fully immunized, not just 2. And we recently saw for our international friends, Israel introduced a 4th shot for people in high-risk categories. With this new variant surging, is the U.S. federal government, maybe health officials or Biden public political appointees, considering redefining what is fully vaccinated, or are we just not there yet?
Both. They're considering it, and we're not there yet. Rochelle Walensky, the director of the Centers of Disease Control and Prevention, Centers for Disease Control and Prevention, said today that the current definition stands, which is that fully vaccinated is 2 shots and boosted is, 2 shots plus a booster. But she did reiterate that the best protection against Omicron is to be fully vaccinated and boosted. She said every American who is eligible, and that is people 16 and older who are eligible for boosters, should get boosters. So whether or not they are redefining what fully vaccinated means, they are sending a very clear message that boosters are essential to protecting against Omicron.
So we just went over vaccines, we went over hospitals. Now let's get into the third leg of this tripod, which to me is going to be testing. There appears to be a massive supply problem, obviously, by the lack of supply and the long lines. Has testing been neglected in the national COVID response?
Yes, single word answer, but I can elaborate. We've really had trouble with testing since the outset of the pandemic. At the very beginning, the CDC bungled its tests. Their test kits were flawed, and that set us back. We had supply shortages. It was very difficult for manufacturers to ramp up quickly and develop new diagnostics. Ultimately, President Trump invoked the Defense Production Act to try to help manufacturers along. And by the end of 2020, I think we were at kind of an equilibrium where we did have enough tests for people who needed them. But then the vaccines hit, and we all turned our attention away from tests and toward vaccination, and demand for testing plummeted, and testing sites started closing. Even Abbott Laboratories, which is one of the biggest manufacturers of rapid at-home tests, destroyed millions of their at-home tests destroyed millions of tests rather, because there was no demand for them. And now here we are 2 years into the pandemic, and we're really in very much the same situation that we were in at the beginning, which is that there are more people who want tests than there are tests to be had.
Yeah, so with the surge in supply, and you said, or demand rather, and the originally demand had plummeted when we switched over to vaccines. Help me understand how much of this is actually the fault of the Biden administration, because I think public health officials and experts have been fairly consistent that vaccines may wear off, that it's very likely we're going to have numerous variants of coronavirus and maybe one or two become dominant and potentially have breakthrough cases. And that because of those two factors, these public health experts, not officials in the Biden administration, they've been relatively consistent on needing to up our testing game, needing to put a bunch of these tests in a stockpile, and needing to have a national plan to get these tests out there. So how much of this does fall on the Biden administration? Have they been neglecting public health officials' advice? Or how should we understand this dearth of testing at the holiday season in the middle of a spike?
Well, I think that, when President Biden ran for office, he promised that he was going to ramp up testing manufacturing, and he was going to help bring rapid at-home tests to market. And to be fair, he has done that. There's a much greater supply now than there was when he was first inaugurated. There were no rapid at-home tests on the market at that time. Now there are about a dozen. So he has done some of what he criticized, or has fixed some of what he criticized President Trump for, which was, ignoring testing and not doing enough. That said, a number of public health experts tell me that the Biden administration really didn't look around the corner, that in having a very singular focus on vaccination as a way out of the pandemic, it took its eye off the testing ball and wasn't able to, or didn't foresee that we would have another surge and a need for testing. Now, whether that's the fault of the Biden administration or maybe it's the fault of the public that said, "Wow, like we're all vaccinated, we don't need tests." Um, it's hard to determine, but I think the fact stands that we're in a situation where we need more tests and we're behind the curve.
We are, and as Build Back Better is being negotiated and people keep hearing about the top line price number, back to the American Relief Act, there was a congressional appropriations of $48 billion just for testing in the Relief Act. So I got to ask, what has happened to that money? Did the Biden administration efficiently manage and deploy that money? Did they run out of money, or is there money just sitting around and not being utilized to get us through this dire moment?
That's a good question. I know that they set aside, I think, $10 billion for testing in schools. The president announced in September that he was going to set aside $2 billion, and then in October he announced another $3 billion to expand testing. That doesn't really get you anywhere near the amount that Congress authorized, but in fairness, they may have spent that money some other way that I'm just not aware of. I don't think that they're overflowing with money right now, or that they've just been sitting on funds that aren't used. But I don't know that for certain.
Yeah, and then just for the audience's sake, the Biden administration did kind of reapportion $550 billion in unused COVID funds to the bipartisan infrastructure bill. So then we can get into the question: were they prioritizing infrastructure over public health, which is another one, but that's maybe for another day. So I wanted to get into another just overarching question here from your perspective. At a debate in 2020, October 2020, President Biden is quoted as saying something, and I'm going to paraphrase, that there's 220,000 dead Americans, and anyone who was president watching over this and is responsible for this should not remain president, and promised that if he were to come into office, that he would have a plan to get us past coronavirus. After a year in office, from a lot of people's perspectives, we just don't seem any closer to the end of the pandemic. We're at now over 800,000 American deaths. Does Biden and his team have a concrete, cohesive plan, or are they more moving from one problem to the next problem? And like you said, maybe not looking around the corner.
Well, I think they have a plan, which they published when the president took office. But in fairness to them, as Michael Osterholm, who is a leading infectious disease specialist and epidemiologist, told me, he said, the virus hit us with a number of curveballs and they're coming at 200 miles an hour. And I do think it's reasonable to say that there are some things that are simply beyond the president's control. He cannot control how a virus mutates. He has discovered that he cannot control the vaccine uptake of many Americans, some 70 million of whom, are very vaccine resistant. I think they thought going in that, we would get everybody vaccinated and, 1, 2, 3, this pandemic would go away. And it has proven to be not that simple for a number of complicated reasons. Also, not least of which is that there's a whole world out there. This is a global pandemic. It's an infectious disease outbreak. And, you can fault him for not doing more to bring vaccines to other nations. Certainly, activists have faulted him for that. But this is a very, very big problem. And no president in modern history, at least not since 1918, has faced this kind of problem. So, I think there are questions. People say, well, he put out a good plan. Is he following it? Did he make missteps? Probably. Dr. Fauci was asked today, can he point to anything, any one single thing that he thinks the administration did wrong since the emergence of Omicron? And Dr. Fauci is very skilled at answering press questions, said, look, I'm not saying that we're perfect. Surely we've made mistakes, he said, but he couldn't point to any one single thing that was wrong. That's not surprising, but I do give him credit for saying, yeah, of course, we're not perfect. We made mistakes.
So I want to turn our attention. We've just hit on the current status of the variant and U.S. health system. We just hit on testing, and we've hit on Biden's plan. I want to kind of get into the big elephant in the room, which is President Biden's speech. Sheryl, I'm wondering, what were the major policy steps that President Biden outlined in his speech to get us back to a sense of normalcy and through this spike in variant?
Well, we just talked about testing, and one of the big things that he announced is that he's going to make 500 million rather tests available free to the public via a website that will come online in January. So he is leaning into testing. He also took some steps to open new testing sites, new federal vaccination sites. He said he is putting 1,000 members of the military, health professionals, including doctors and nurses and paramedics, on notice so that they will be at the ready to mobilize to hospitals that may be overwhelmed. He's sending out planners from the Federal Emergency Management Agency to hospitals to help them plan for the eventuality that they, might run out of space to care for patients, and to help them try to figure out ways to expand hospital capacity. And he's opened up already some new testing sites in New York City. One opened up today in Queens, and there'll be two others opening up on Thursday. So he is trying to, I would say, accelerate his response. Whether it will keep this variant in check, I don't think any plan, frankly, could keep this variant in check. It is that infectious.
So you've outlined, 1,000 guardsmen and women to hospitals, 500 million tests. That all sounds like a lot of materials, a lot of people. How is President Biden's response being received by the actual public health experts? Do they believe it's sufficient to help? Maybe, like you said, not get it completely under control, but to help us get in the right direction?
I think I'm getting some mixed reaction there. I talked to Marcus Plesha today, who is the chief medical officer for the Association of State and Territorial Health Officials. And he said, by and large, that his members, who are state health officials around the country, felt like Biden did pretty much what he could. And he did not hear, he said, a lot of grumbling about this plan. Other experts, are grumbling. I wonder, frankly, if the president might call them armchair quarterbacks. But they are saying that, it didn't go far enough. There are other things he could do. He could, for example, require that anyone who gets on a plane show proof of vaccination. He hasn't done that. Dr. Topol, who you mentioned earlier, wrote that perhaps the government could send KN95 or N95 masks to every American household. So there are a lot of ideas out there for what the president can do. But I think they all have to bump up against the reality that this is a variant that, now accounts for roughly 3/4 of all new cases in the United States. And like 2 weeks ago, accounted for maybe 2% of all the cases in the United States.
Yeah, it's been crazy how this has become the dominant. So quickly.
If you look at the curve, it looks like the Apollo rocket going into space. It is going straight up.
It's not. I apologize. It's not a laughing matter. I know a bunch of people who have tested positive. It's just so ridiculous how virulent this is.
It is, but I think we should actually pause there for just a minute and say that for most people who are fully vaccinated and who are boosted, the high likelihood is if they get infected, they will experience mild symptoms or maybe even no symptoms. And that the real risk is to people who are immunosuppressed, who are very elderly, and also to the unvaccinated.
Yes, and then when our hospitals get overwhelmed because of those people, then it becomes all of our concern.
Yes, that's
if we
exactly
get in a car
right.
accident, right?
Exactly right.
No, so I think we're on the same page. So I'm just going to have two more questions for you, and then we'll go to the meat and potatoes of our event, which is the audience. Your readers will actually get to ask you questions, which a lot of writers tend to enjoy. So we've just been a little bit critical, I have at least, of the Biden administration's response, falling flat-footed on testing. They repurpose vaccination sites, test sites as vaccination sites. But I want to look at the former administration's response to COVID and at least juxtapose the two for our audience here. This week, Congress released a scathing report on Trump administration's response to the COVID pandemic. Do you have any key takeaways, maybe footnotes that you could give us? Because I know everybody's not going to go and dig into, a long, lengthy congressional report, but maybe you have some areas that we should focus on or take note of.
Well, I'm going to be completely truthful here and say that I have been so swamped this week that I have not yet read the House Select Subcommittee's report, but I can surely tell you what they've come up with because I've been following their work. And I know that their concerns are that the Trump administration, did not follow the science, prioritized friends and family members. They gave contracts out in a politically connected way. They interfered with the science by trying to pressure the Centers for Disease Control and Prevention to change its guidance. These are all things that the committee has been investigating, all throughout. So maybe if you've read their report, I'd be interested in hearing what their takeaways were. But I know that those have been major concerns of the committee, and in fairness, again, to President Biden, every expert I talk to says that this administration's response is light years away and better than the previous administration's response, where you had a president who did not listen to science, muzzled CDC officials, tried to interfere with what the CDC was doing, did not take a leadership role in wearing masks or in, promoting vaccination, and that the conclusion is from the experts I talked to is that at least the Biden administration is trying and is serious and making a serious effort to follow the science.
So I did read some of it, but people, Sheryl, they're here to hear you. They're not here to hear me. But,
okay.
No.
Well, was I right?
I'm tongue in cheek. I'm joking a little bit, but no, you hit on it. The point that really was salient throughout this is President Trump was playing politics. He was sidelining scientists and trying to put his political fortunes ahead of the lives of hundreds of thousands of U.S. citizens and Americans. My question to you, though, and you said the Biden response has been light years ahead. Like we just mentioned, the Trump administration got criticized for sidelining career public health officials. And for people in the audience, there's a big divide between your administration officials who are career folks. They work there no matter what the administration is, and the people who are appointed folks like Jen Psaki, who's a Politico, and she's the communications director, or the head of HHS, which changes every administration. So I'm wondering, from your reporting, you're a health policy reporter, is the Biden administration maybe not to the same level as the Trump administration, but are they getting criticized for sidelining career health folks, or are they truly and seriously following the science with their response?
Well, some of the Tony Fauci is a career health official, and he's the president's chief medical advisor for the coronavirus. And I certainly don't think that you could argue that he's been sidelined. The CDC, not CDC, rather the FDA commissioner, the president has appointed a new commissioner who has not yet been confirmed, but the acting commissioner, Janet Woodcock, is a career scientist. So I think that career scientists are at the center of the Biden response, but at the same time, some career scientists have left because they have felt that there was too much interference from the White House. And I'm thinking of two top FDA officials who left. They were upset that the White House basically got out ahead of the FDA and said that there would be boosters for every American or every adult American. And those, they were longtime career scientists and they got fed up and left. The CDC lost two longtime career scientists, Ann Schuchat, who was the top deputy director, and also Nancy Messonnier, who famously was muzzled by President Trump. Now, they may have decided they wanted to retire anyway. Those folks are really kind of exhausted and burned out. So I hate to sound wishy-washy, but I think you could make the case both ways, both that career scientists are at the center of the administration's response, but there have been times where, because the response is centralized in the White House has exerted itself in a way that career scientists have taken issue with.
No, thank you for that nuanced approach, not wishy-washy. So folks, now we go to the meat and potatoes, the audience. So if you're in the audience, we'd love you to raise your hand and we will do our best to vet you, invite you up, and you will get to ask a question. Try and keep it on U.S. health policy and specifically coronavirus. That would be fantastic. So for our first guest, and I apologize for putting you on the spot, we'll go to Salmaz, and then after Salmaz, we'll go to Piotr. Salmaz, over to you.
I was hoping Rick would go first so I can make sure my question is okay, but thank you for that. Hi. So I'm very much interested in this topic from work perspective and travel perspective. And my question is, I have a couple questions. I'll try and summarize them all into one is, why do we not in the U.S. require any type of testing or vaccinations for state-to-state travel when it's spreading so fast, when other countries' responses are so different? And this comes from, I had a bunch of friends from work go to an event in New York last week and everyone tested positive. Now they're all quarantining. They all have COVID, some for their second time around. And I'm just curious why, as a country, we're not doing that. I'm a traveler. I've traveled outside the country. During COVID, going into any other country, I basically have to hand over my left kidney and 25 different forms, 3 or 4 different tests, quarantine to just be able to get in. And it just seems like in the US, it's spreading from state to state. So do you anticipate any type of regulations from state to state travel? Or I don't know if that question is appropriate for this room or not, but that's a question I've been meaning to ask anyone at any point that I can. Thank you.
So I have a couple of thoughts about that. That's a good question. You might remember that there was a period where many states were requiring people to quarantine if they came over the summer. If you wanted a vacation, I think in Maine, you had to quarantine or show proof of a negative test. So there have been such requirements, but that said, it would be very difficult to enforce. I mean, how are you, if I drive to New York, I'm based in DC, and if I drive to New York to see my mom, there's no gateway that I have to go through or I would have to show proof of vaccination. I mean, I'm just going to drive in. So it doesn't seem like it would be a workable plan in the United States. Whereas if you do go to another country, you're either flying there, in which case you are going through customs, or you're driving there if it's to Canada or to Mexico, and you've got to go through, a border checkpoint. So there's a way to prove that. So, but states have tried to impose their own controls, and that's up to the individual states.
Thank you very much for that question and answer. We will go to Piotr, and then we will go to Drew. Piotr, over to you.
Thanks, Justin, and thanks for joining us, Cheryl. Lovely to listen to your great perspectives. I'm going to do my best to frame my sort of international question from a US-centric perspective, because I focus on international affairs predominantly. But I was reading an article in Foreign Policy, and it was talking about, US is blunting China's vaccine diplomacy in Latin America. And vaccine diplomacy is something I'm very, very interested in, and also quite concerned by, as you know, the US tries to sort of offset China and Russia's abilities to spread like Sputnik and China's vaccine, I forget the name of it, respectively. So my question is just generally, how can the United States balance taking care of its own citizens and ensuring that it has enough vaccines, whilst ensuring that it can leverage itself as the leader, the democratic leader of the free world, etc., in a way that other countries can look to it for reliable support during these times. If that makes sense, I can clarify.
It does. No, I've actually written a lot about this. So, and this is an issue that President Biden has really struggled with, I think. So you'll remember at the outset of his presidency, he really took kind of an America first approach, where he said, we're not going to be giving vaccines away before Americans get their chance. And there was a lot of concern about that, especially in the spring when we saw the Delta surge in India, and it was a terrible crisis there. And finally, the president, buckled and said, the first thing he did was he said that he was going to partner with Japan and India and Australia to expand global vaccine manufacturing capacity. I think that was in March. And then I think in around May or so, they announced for the first time that they were going to make some donations to needy nations, and we've seen that he has ramped that up, and he's committed to donating over 1 billion doses. But still, he's been facing accusations of vaccine hoarding, and the booster campaign, in particular, has drawn complaints from people who said, look, we're on our third shots here, and you've got healthcare workers in African nations who can't even get their first shot, and that is unfair. And the president has said that he wants the United States to be the vaccine arsenal of the world. He has not taken some steps that many people would like. He's not really pressured the big vaccine makers, Pfizer and Moderna, to share their technology with manufacturers overseas. And he's relied really on kind of a donations strategy, and on rather than a strategy of building up manufacturing capacity in other nations. So I think you raise a really good point. And I think that it's important to note that if everybody's not vaccinated, it's almost as if nobody's vaccinated, right? Like this is a global pandemic, and it doesn't stop at our borders, as we have seen. So I hope that answers your question.
Thank you very much, Piotr. And yes, that makes a lot of sense. So we will go to Drew, and then we will go to Monica. Drew, over to you.
Thank you. Appreciate it. So, it's interesting. This administration has done so well with, just making sure that people have access to vaccination. And even just most recently, just being able to, President Biden approving the sending out of testing kits to Americans' homes is fantastic as well. But one of the things that's actually, I guess, disappointing, or just, leaves a lot to be desired. Not say disappointing, has been the international response to Omicron and the travel restrictions, particularly when we're talking about South Africa and other African countries. When we see that Omicron is virtually ubiquitous, I mean, yeah, maybe that's a gross and insensitive overstatement, but it seems to be everywhere. And I'm wondering if we would. Do you think, in the opinion of anyone, that we could, see some sort of reconsideration of those travel restriction policies, as they relate specifically? I mean, really, to really anyone, but especially to South Africa and those African countries. I mean, we look at South Africa; they caught this particular variant sequence that warned the world. I think saved a bunch of lives. Now, we're on guard. We understand what's happening, and it's almost like I call it a slap in the face. And so I'm wondering, in the opinion of anyone on the panel, that you think we may see some reconsideration of those travel restrictions. But I'm done.
Well, the president said yesterday that he is reconsidering it. They said at the outset that these travel restrictions would be temporary. And you're absolutely right. A lot of global public health experts feel that it was not only a slap in the face, but a disincentive in a way. Like, South Africa did exactly what we want our international partners to do. They tracked this variant. They were transparent about it. Their scientists, announced it. They briefed the White House, and then Washington turned around and imposed a travel ban that is harmful to African economies. So I don't like to predict what the president will do, but since they did say that it was going to be temporary, and he did say yesterday that he's thinking about lifting it, I wouldn't be surprised if at some point in the near future that does happen.
Thank you for that great question, Drew. I know a lot of people have been wondering about that. So we will go to Monica and then Rick. Monica, over to you for a question.
Thank you so much. So I am part of the millions of people who are immunocompromised, in my case, because of an organ transplant. And we're usually an aside, an asterisk in a story. This applies except for the immunocompromised. And I'm curious what the conversation has been at the higher levels to really address the vulnerabilities and the fact that we know through studies, I'm part of the Johns Hopkins studies, that the vaccines are not as effective for immunocompromised folks. Thank you.
I think that's a really good question. And I think you just put a story idea in my head, because I don't know the answer to that question about what are the conversations at the highest levels of the White House about people who are immunocompromised. And I think you could make a very strong argument, for instance, that we should be prioritizing testing for people who are immunocompromised. I know that Jeff Zients today said that the government is acquiring some treatments. AstraZeneca has a treatment that is for pre-exposure that is supposedly useful for immunocompromised people to take to prevent infection. And he said today that the government will be acquiring several 100 million new doses of that treatment. So that suggests that they are thinking some about it. But I think that, that is a really important issue, and I'm really glad you raised it. And be careful.
Thank you very much. Thank you, Monica. And it was great. We welcome you both and Drew back to ask questions to future guests. I guess, Sheryl, can you go into the testing aspect? Is it that more testing will allow us to catch it earlier for people who are immunocompromised, and then maybe we can use some medications and treatments, or is there another aspect of testing?
No, that's exactly right. Testing is important for two reasons. One, it's important to diagnose if someone is infected, and especially with these new treatments coming online, the Pfizer antiviral pill, which I think got FDA authorization today, and the Merck, which is supposedly coming online, those medicines need to be used early in the course of infection. So you want to diagnose early, which means testing early, and treat early. And then the other reason to use testing is, frankly, just for peace of mind and also to protect people. So, for instance, my family's plan is to go see my mother-in-law, and she has cancer, and so we are all planning on, using rapid tests before we go see her, to make sure that she's safe. So I think that's the way that we could be maybe prioritizing the use of testing. Not just, hey, I want to go to a party, so I'm going to be testing tonight, but, testing so that we can identify coronavirus infection in people who are vulnerable, and testing to protect people who are vulnerable.
Awesome. Thank you very much. And folks, Politics and Media 101, nonpartisan show, getting into the most politically charged issues with the top experts around, usually in the US, but sometimes internationally. We are in the question and answer portion where we have 3 rules. Number 1, wait to be called on. Number 2, always be civil. And number 3, be short with your question, just like Drew, Monica, and the rest of our audience has been tonight. On that note, we will go Rick, and then we will go Aram. Rick, over to you.
Thank you very much, Justin, and thank you, Sheryl. Some great insights. The question I have is, according to the CDC, the Omicron variant was detected on November 24th, but it was from specimens collected, a week or 10 days, 12 days earlier, something like that. Considering the hyper spread of this globally, it's probably reasonable to assume that it's been around for quite a bit longer, without us knowing it. And does that suggest that we really need to step up our genetic sequencing of specimens and testing in the future to find other variants? And that's my question. Thanks.
Yeah, I think there's been a lot of talk about stepping up our genetic sequencing, our genomic sequencing, and stepping that up around the world. And there's a lot of efforts to do that. I know that the Rockefeller Foundation, I think, is undertaking a major initiative to try to create a global network, a global surveillance network to identify new pathogens. And I think that's one of the lessons of this pandemic, is how important it is to be on the lookout for new pathogens, and also to be transparent about it. And you'll remember that when the SARS-CoV-2 was first identified in China, the Chinese were not all that transparent early on, and that set the world back. And so I guess the answer to your question is yes, that is necessary, and there are certainly moves in that direction.
Thank you for that question. We will move on. I believe I said Aram, and then we will go to Ken. Aram, over to you.
Thanks, Justin, and thanks, Sheryl, for being here. With the Omicron variant being so virulent, it seems like it's even more important that we understand what good public health policy looks like in this moment in particular. And I've been playing with the New York Times COVID tracker and noticed that when you sort total cases, right, so we kind of look at the long arc of this thing, we look at which states have the highest caseloads. It maps almost perfectly to how much a state voted for Trump versus Biden. The higher the Trump, the more cases. And when you look at deaths, that's also true, with a little bit of an outlier in that if you're in the Northeast, there are a lot of deaths early. But if you sort of eliminate those first few months, you see the exact same pattern. And I'm just wondering, I feel like the media is kind of tired of talking about public health policy and what the impacts have been. And I'm just wondering, where you see that reporting happening or not happening, and how important you think it is in this moment. Thanks.
Well, my colleague David Leonhardt, who publishes our morning newsletter, has done some really good work in this area. And he has reported that the per capita death toll in blue America and red America, blue states and red states, was very similar at the end of 2020. But once the vaccines hit, that gap really started to grow. And I think he reported, I would have to double check, that in counties that voted for President Trump, the death rate was from COVID-19 was more than 3 times the death rate in counties that voted heavily for President Biden. So there has been some reporting in this area. We know this is happening. I think of it from maybe a little bit different way, which is, what is the Biden administration doing to reach those Americans in, Donald Trump's orbit, to try to persuade those who are hesitant because of political beliefs to, abandon that hesitancy and get vaccinated. And I think we saw the president take a step toward that yesterday. Actually, in his speech at the White House, he both mentioned that President Trump had announced that he received a booster shot, and he also mentioned that thanks to the Trump administration, America had vaccines early on. And I thought those were good steps and, really important steps, because just, saying over and over again that if you're unvaccinated, you're going to die is not really a way to convince people to get vaccinated. So I hope that answers your question.
And Trump went as far.
Thank
you very much, Aaron. Trump went as far to praise President Biden for praising President Trump. So at least there was some type of, unity. And it's been very odd, actually, because President Trump hid the fact that he got the vaccine, but now he's promoting the fact that he got the booster. So that is also another positive aspect of things. We will go to Ken, and then we will go to Kevin. Ken, over to you.
Thank you, Justin. Hey, actually, that was kind of going to be my question. I should point out, actually, if you saw the video, Trump did something, was at some sort of function with Bill O'Reilly. And when he mentioned he got the booster, there was actually a small group of people there who actually booed him. Because I was wondering, too, how do you reach out to his supporters? So I'm going to ask a different question then. New York City has a rule that they're requiring vaccinations for children. Los Angeles was going to impose a rule, and then they decided to back off for a year. And these are cities that are very similar in terms of being, the 2 biggest cities in the country, ethnically diverse, democratic cities. How is it logical that we have different policies between New York and Los Angeles as about vaccinating children? Because even if children generally don't get too badly hit by this, they could all be carriers. And so that would have been my question here.
Mm-hmm. So I think the structure of the vaccine system in the United States has always been kind of vexing in this pandemic, in that in the United States, the states control vaccination policy. It's left to state and local governments, and certainly in school districts, it's left to the individual school districts. And that's played out in a number of ways. For instance, we have no national registry of who's vaccinated. We've had this huge debate over whether or not we should have a quote unquote vaccine passport like Israel has, where you'd have a digital proof of your vaccination. But we don't do that in this country because every state is in charge of its own vaccine registry. That also means that the registries don't talk to each other, and we have different policies. And this is true for all kinds of vaccinations. So, in fact, Mississippi, which has one of the lowest COVID vaccination rates in the country, actually has one of the highest childhood vaccination rates because it does not allow for religious exemptions for childhood vaccines. Other states do allow for childhood exemptions. So it's just our patchwork system that, leaves us with 2 school districts on opposite sides of the country coming up with very different policies for their students.
That's fascinating. I didn't know that about Mississippi and would never have thought that. So thank you very much for that question, Ken. We will go to Kevin, and then David will be our last questioner of the night. Kevin, over to you.
Thanks, Justin. My question is, being exposed to the virus becomes an integral part of the solution, right? And contact tracing was one of the ways in which they were trying to find remedies in order to be able to curtail the spread of the virus. Now, that comes with, for it to be really effective, you probably need some form of technology in today's world where it's almost like real-time tracking. At what point will, and today we have social media where people share information and all that kind of stuff. And there's some level of privacy that comes with it. At what point will technology be a focal point in trying to find a solution to this problem?
In the United States, never. It's never going to happen. In South Korea, for instance, they use cell phone tracking technology to track people who are infected. But I just think in this country, that is just a non-starter. I could be wrong, but I would really be shocked if that ever happened in this country.
I would be stunned too. I worked for Tim Huelskamp, a former Tea Party member, before becoming a Democrat, and the people in his district would revolt the people in Kansas if we began tracking people with technology.
Yeah, what do you think Governor Ron DeSantis in Florida would say? He doesn't even want, they passed a law saying that businesses or that do business with the state can't require proof of vaccination. So can you imagine the thought of how that would go over, of using cell phone technology to track people who are infected?
Probably not pretty well. And man, it's just making me wish that we go ahead.
Because our cell phones know everything about us.
They're already tracking us. That's part of the problem with big tech.
Right.
That we're all pointing to these problems, and all these members are pointing to these problems. And I was going to say, Sheryl, it's getting me interested in the original topic, which we were going to discuss with you, which is how our politics in Congress has evolved over the last 20 or 30 years. But we'll save that for another day. We will go to, I believe I said David was going to be our last question of the night. David, over to you, and then we'll kick it over to Sheryl for her thoughts.
Thank you, Justin. Appreciate it. Yes, my question is, I used to manage a division of Quest Diagnostics, and I managed some of the outreach during the SARS epidemic. I've also developed about over 40 different diagnostic tests in my career through my company. One of the things in the healthcare space, and when we look at what's taxing the healthcare system and the aspect on a broader basis, is that the aspect of diabetes, obesity, all these other issues, and even comorbidities around like obesity, where if you look at the fatality rate of COVID cases, if you have patients that have a body mass index over 30, it's dramatically higher fatality rate with those patients that have had COVID and with all the strains of COVID than patients that are lesser weight. Should we have, in your point of view, do you think we might see some influence through Obamacare exchanges or through the insurance coverage or through Medicare, Medicaid, TRICARE for military, even employer-based healthcare has tax benefits that they receive to issue care. There's a lot of points of leverage that could be done to have a national healthcare policy influence to maybe make the entire nation healthier and to maybe shift from a sick care system like we've had and what we have right now to something that maybe address these issues so that next time a pandemic comes around, people are healthier. If you could get your thoughts on that. Thank you. I'm done speaking.
Yeah, I think that, that has really been the dream of healthcare reformers for a long time. And certainly when Obamacare passed, there was a lot of talk about trying to incentivize preventive care, to address, underlying health issues like obesity, to focus more on, well care so that you didn't have to pay all kinds of money for sick care later on. And I think that goal has really, in a way, eluded us. in this country. A lot of the demonstration programs that were envisioned during the Obamacare debate, I think, I don't want to say they didn't pan out, but I don't think we've seen the kind of change that healthcare reformers had envisioned at that time, and that is really still a task that's that is ahead of us in this country, far beyond the pandemic, is just the general health of the nation. So I think you raise a good point.
Well, thank you, everybody. Before we leave, Sheryl, I wanted to kick it over to you. We've reached roughly 3.5 thousand people here during our discussion. I was wondering if you had any last thoughts. It could be on Biden, could be on Trump, could be on the health policy, coronavirus. It could be positive, negative, or somewhere in between. But what do you want to leave us in the audience with?
I guess since it's the end of the year and I'm being a little reflective, I would leave the audience with my own personal wish, which is that we could come together as a country. We saw at the beginning of this year, the January 6th insurrection at the Capitol. I spent a lot of my career at the Times covering Congress and sitting in a little desk on the third floor of the Capitol. And, we see now these great political divisions that we discussed in this episode, in this discussion about, people who are living in red states are, more likely to die of coronavirus than blue states, and these kinds of fights over things that shouldn't be fought over, public health, the common good. So if I could have a wish for 2022, it would just be a wish that we could all come together a little bit more, and that we could view this pandemic in particular as a common enemy and not something that divides us.
That's all we have for you today. Again, huge thanks to Sheryl for coming out, to the New York Times, to our audience for their questions, and to you for being here. If you like or dislike what you hear, if you want to find out how to join us live almost every day of the week, maybe ask one of our upcoming guests a question, or hear past episodes, please visit our website, pm101.club or pm101.live. They both work and will get you to the same place where you can find all that and more. This has been Politics and Media 101, produced in partnership with Clubhouse. I'm Jeff Browning. On behalf of Justin Higgins, our co-founder, and our team, thank you very much for being here. We hope to see you and hear from you soon.